Okay, so now we've already kind of given you an intro to fluids. We've talked about number one, which is your maintenance, which you always want to remember that you got to talk about maintenance fluid first. And then on top of that, you have to make up for dehydration or deficit. So, what are some signs and symptoms in infants or children of dehydration? So, here's my littlest one, my little baby. Okay, so there's some things that you can think of. You can look at the fontanelles, right? So every peds exam you want to start with the easy stuff first. So anterior fontanelle, or you can't see in this baby, but you look at the posterior fontanelle behind. Are they flat? Are they sunken? You can look at things like mucous membranes, right? So are they moist? The eyes, do they have real tears? You can look at things like cap refill. Now, cap refill, you're probably taught to look in their little fingers, but especially newborn infants, they have, in the first couple days and maybe weeks of life, they have some acrocyanosis. So I actually just check right here in the chest or in the belly and just put your finger down, see if you get good cap refill or return of the color of the skin. And it's usually pretty accurate. You can also look at the same time as you're doing that for skin turgor. So I just do the two right at the same time. Of course, I didn't show it in this picture, but you can look below at their diaper area and just ask the parents, do the diapers smell different? Are they stronger? Do they look darker? How much are they peeing? How many diapers are they making today? And again, that's one of those things that you may not know what's a normal diaper amount for a baby. So just ask them what their normal is. Usually by the time you're a week old, most infants make, I'd say about 6 to 7 diapers a day. Now, of course, that depends on how often the parents change the diapers. So hopefully you're a good parent and you change the diaper all the time, as soon as they wet. There are other things that are later signs. So things like this would be things like tachycardia. So are they tachycardic yet? Looking at their blood pressure. These are late signs, so by the time you're tachycardic and your blood pressure has fallen down, then you're starting to get into trouble. If you have a UA, you can look at your spec-grav, although that's not per se a physical exam finding, but it can correlate with a discussion with the parents about diapers. And then based on this, you should have a pretty good overview, and you can do that quickly, like 30 seconds to a minute you can calculate that, except for maybe calculating the blood or figuring out the blood pressure. But you can do a real quick exam and figure out how hydrated or dehydrated that baby is. Now based on this, we talk about degrees of dehydration, so they can be mild, moderate, or severe. And based on that, this is a very general overview, but you can actually know, based on how severe on exam they're dehydrated, what their weight loss is, and make up for that in their volume of deficit. So this is a little simplified because their body surface area changes as they get older, but in general, in an infant, mild dehydration means you've lost about 5% of your body weight, which calculates to about 50 mLs per kilo. So that's a quick way, if you have a 10 kilo infant who you think is mildly dehydrated, it's just 10 times 50, and you know that you have 500 mLs of fluid to make up in that 10 kilo child. So it's a really nice, fast way of calculating it. Also, if the baby was recently in clinic, say a couple days prior, and you have a weight, you can use that and actually just substitute the weight loss for volume. For kids, older kids, that's a little harder because maybe they haven't been to the doctor in a while, so it's harder to compare. But looking down this mild dehydration category, you can see that there's really not very much that's abnormal. So it's pretty normal there looking. Compared to moderate is when you really start to see more vital sign changes. They're tachycardic, their pulse might be weak, cap refill starts to be delayed. The fontanelle is still normal, and tears is a little hard to tell if it's just decreased versus absent. Maybe the mucous membranes are a little dry, etc. Now remember, mucous membranes, that one can be challenging for some of our kids, especially if they have G-tubes, for example, or they don't take by PO. Don't just use mucous membranes. And by the time you get to severe, then you're worried about shock here. And this is when you really start to see the delay in the cap refill, you see the blood pressure fall, they're already tachycardic. But this is very concerning at this point. Now in a child who is at least moderate or severely dehydrated, you have to think about boluses. And boluses are generally through the IV, although you can bolus through an NG tube or a G tube, for example. And usually boluses in peds, we talk about 20 mLs per kilo boluses. And this is something I even remember being asked about on my ped shelf quite a few years ago, is how to bolus and what to bolus with. Whenever you bolus, you always want to bolus with isotonic solutions. So no dextrose in a bolus, if it's just for volume. Maybe if the child is, obviously if the child is hypoglycemic, then of course, sure, that's a different case scenario. But in general, no dextrose. Dextrose is a no for a bolus. And remember, our isotonic solutions were ones like, for example, normal saline, so 0.9 normal saline, or LR. So you want to give that bolus of 20 mLs per kilo of normal saline or of LR. And that's for those kids that fall into this category of moderate or severe. Now there are different types of dehydration. We're going to talk just about isotonic dehydration, but be aware that there are other types where you're either hypernatremic or hyponatremic, and so your fluids will change a little bit differently, but that's a talk of its own, hypo and hypernatremia. Another topic that I've come to grow to love as a med-peds person. But isotonic is when you lose both water and sodium equally, and so essentially you have a normal sodium. Okay, so going back, remember that for any fluid orders, keep that step number 1, which was your maintenance fluids, and calculate those first. So in our case, we did the 4-2-1 rule. And then on top of that, you have to add your deficit. So that's what we just calculated on the last one where we looked at this. So that's using generally this row right here. So your volume of deficit that you have to make up for. And that deficit, this is the same from the table before, is basically your weight in grams times your percent dehydration, which another way of saying it, again, was that second category, second table here. So same number, it's just different units of conversion. And again, this has to be replaced in isotonic fluid. Otherwise, you'll cause some major electrolyte abnormalities in a child if you're bolusing with inappropriate